Students can report anonymously or not, and they can choose to participate in the process or not, because the process can be harmful. And oftentimes students are scared that they'll face retaliation, but students are protected from retaliation. So the office will meet with the student, consult with them, and see how involved the student would like to be in the whole process. And overall, students can enjoy gender affirming housing on campus through like the Rainbow LLC, which is a living learning community. And they are able to come into the center and get resources from myself and other staff members at the center, so that it facilitates their coming out process, because a lot of the trans students are not just dealing with coming out and transitioning, they're also dealing with family issues. Sometimes family can be unsupportive, and so it's a stressful time as they're going into adulthood. So yeah, students are protected from discrimination on campus, and we're working on making sure that students can show up authentically in every space and be affirmed in their name and gender marker as well.
Blake, in your work on the Gender Recognition and Live Name Implementation Committee, what are some improvements that you have seen on campus with your work in that committee?
Yeah, so I'm specifically chair of the training subcommittee. So I think there's been a lot of progress in terms of the trainings that are available to different departments, whether they're supervisors or students or staff members, faculty. The resource toolkit that I mentioned earlier about trans rights is being distributed. We're actually working to, so I've been going to various department meetings to advocate for folks to embed this rights toolkit into their onboarding processes and any student trainings that they have. There's also a human resources resource for supervisors and staff was also developed. So there's a whole section on the HR website at UC Davis now that talks about the going through the gender affirmation process in the workplace and resources for managers and supervisors. We also created a best practices for supporting transgender and non-binary communities as part of the implementation committee, and so that's also being distributed throughout campus. And also we recently formed or we're in the process of forming an advisory board of trans students and staff who can help better inform the work of the implementation committee. So that's exciting. Yeah, all kinds of things, but a lot of impact so far besides the system changes that have come down, because the actual deadline for implementing the policy is December 31st. And so hopefully by December 31st, it'll be fully implemented. Yeah.
Our next question is for Rainer. As trans students begin to graduate and enter the realm of professionalism, searching for jobs, what are some things that they should know in terms of their rights against discrimination and that aspect?
Yeah, definitely. This is like a huge question, I think, for a lot of people as they're entering the workforce. I'm recently going through all that myself. I graduated a couple of years ago from undergrad. Something that I've thought a lot about. There are a lot of protections against harassment and discrimination that are codified in California law, so you do have a lot of rights here, like legally, to protect you, but we all know that maybe like your legal rights and your rights in practice don't always feel the same. So you do have, like, for using a restroom, you have the right to use the restroom that feels most appropriate to you. If there is a single stall restroom, it does have to be a gender neutral or gender inclusive stall. That's something that in the state capitol was a big fight to get implemented. You have protection to express your gender identity and expression, and to use, I think similarly to what you all have on UC Davis's campus, to use kind of a live name and pronouns, even if it doesn't match your like court documents currently. So that's something that I personally just went through. I was using my chosen name, which only very recently became my legal name, and your employer does have to respect that, use the pronouns that you go by. They can't intentionally use the wrong pronouns for you. I think people making mistakes is definitely probably going to be an ongoing thing, but legally you are protected to have people use your pronouns. And your gender. You do have a right to dress in a way that matches your gender expression. In interviews, you can't get asked any questions about your sex assigned at birth or any questions that are indirectly trying to lead to that. So you should have protection there, no matter what your gender identity is or how you present. You don't have to give away anything. Like if somebody's asking like, oh, like why'd you change your name? That is not allowed. You are protected from all of those things. Employers also have to cover your healthcare, so gender affirming healthcare, something I'm going through right now. Your employer does need to cover whatever is currently covered, I believe, under state law for what gender affirming care is. I think recently that also includes like FFS, so facial feminization surgery, top surgery, hormones, things like that. Which is great, definitely still more to go, but that is good that we have that. And there are some exceptions, which I'm not super familiar with for some religious institutions, as well as small employers who, if they have less than 5 employees, they don't have as many requirements to comply to. But overall, yes, in statute, you should have a ton of protections and you're able to go to your HR or make sure that there's policies in place. I think a big issue is that not all employers will have policies in place when you first get there, which can be difficult and a fight. I think definitely is getting better, but again, these are constitutionally protected rights. And so if there aren't policies, then they need to put some in place. But yes, so definitely a big question, but you do have a lot of protections in California.
Thank you. Along the same lines as discrimination, Angel, as a trans advocate on campus, how should trans students go about seeking help if their lived identities are not being respected by other students or staff?
Yeah, so I already mentioned HSTAP, but another way that students can seek assistance with any sort of issues within their departments is by seeking out a trusted staff person. The reason that the trans advocate role was created was to address issues such as that with the trans community. So one thing that I created was a trans advocacy network, and that is a network of about 70 plus individuals from over 40 different departments on campus. And so if a student is facing a difficulty within their department, they're able to reach out to me. I then reach out to the Trans Advocacy Network, to specific individuals within the departments, people who I think could advocate alongside me for the student. And so in the past, we've connected students with a network of individuals within their department because they didn't feel like the department was inclusive enough, and so it was difficult for them to find people to connect with. So I connected them with some folks. Sometimes people also are being misgendered, dad named within their department, and so I can offer to go in and have a conversation with the department head, and that could be with a student or not. I give them the agency to decide how involved that they want to be, because it can be scary, especially as a student. And then someone from the Trans Advocacy Network can join me in on that conversation. Our center is also working on improving the way that we educate our campus partners. So we have some trainings in the works for certain departments, some conversations in the works, but other than that, we're trying to provide a space within the center for people to come and learn about how they can improve their space, because students should not be worried about being misgendered or demeaned or disrespected, because we need to really work on improving campus culture, and department heads and leadership need to also put in that work, because not only is it discrimination, but it just breeds a culture of disrespect, and nobody wants that regardless of what your gender identity is.
Can I add to that?
Yeah.
Okay, yes, everything that Angel said, and I think it's also just important to name, like, UC Davis, UC-wide, California, the state. I think we're kind of known for having pretty robust, inclusive policies. But I think what's so important about this conversation is, especially when we're thinking about the gender recognition and lived name policy that's getting implemented, and making sure that all students know where policies protect them in terms of gender identity and expression and so forth. That policies are only as good as the community can hold them accountable to, or yeah, I think I said that right. So it really takes the community to hold people accountable to those inclusive policies. And so I encourage folks out there, if you're wanting to make a report and you're afraid to, there are many reasons why people might not want to report harassment and discrimination. We are a confidential resource when it comes to sex-based misconduct. The LGBTQIA Resource Center is. And so I just encourage you to reach out to us so that we can give you some confidential coaching around, where can we refer you to, maybe some next steps to take. The Center for Advocacy Resources and Education, also known as CARE, also handles a lot of that. They are the entity charged with handling those instances of misconduct. So there are lots of resources we can point you to, and we can be your thought partner in helping you navigate different systems and resources on campus. So please reach out.
Blake, back to you. In your work as chair of the ACHA LGBTQIA plus equity task, what are some of the major obstacles trans students face when it comes to seeking adequate health resources on campus?
Yes, great question. So for those who aren't aware, ACHA stands for the American College Health Association. And this Promoting LGBTQIA Equity Task Force is really tasked with finding ways to improve LGBTQIA equity across the country in higher education spaces. And so so many disparities we know about when it comes to trans and non-binary students and people in general. But I think when it comes to healthcare access, a lot of what students have shared with us is in literature, different areas of research, different assessments that have been done. I think there's just such an amount of community mistrust of the healthcare system that stems from so many different areas, but particularly when it comes to being afraid of accessing clinic services because someone is afraid of being dead named or misgendered, or maybe they have been dead named or misgendered before and they don't want to go back, or someone hangs a rainbow flag in their clinic, but then they go there and they don't actually experience that inclusivity. And so there's another way that people are, that's another way that mistrust is bred, right? But particularly, finding providers who are competent in working with trans and non-binary concerns and people in general. What does that staff training look like? How can you make sure that if you go to a provider that they are trained? What are ways that we can signal that providers are trained? So it's multifaceted. I think also when you consider all of those different health disparities that intersect when it comes to mental health, substance use, sexual violence, all these things combined, that just not enough people, I think, are aware of and how to address it. And so I think also student insurance systems, not all of them, like we do at UC Davis, cover, for the UC student health insurance plan, not all student insurance plans cover gender affirming care. And so we do here, so that's something to note. And with that said, I'm also going to plug the gender care team that we have at Student Health and Counseling Services. So we have a page on our website and on the Student Health and Counseling Services website for the gender care team, which is a group of medical and mental health providers who are trained in specifically addressing the needs of trans and non-binary people. And so you can go to the website and see who's a member of the gender care team. And that way you'll know you can go there. But they do all kinds of gender affirming care. They do surgery referrals as needed. They can write letters for mental health support, all kinds of different things. So I kind of went from national to campus, but yeah. I just had to plug that.
Oh, and then I just want to note some things as well. I just want to note some things as well is that if you are not covered through UC SHIP and you're covered through maybe like your parents' insurance or an off-campus insurance, sometimes out-of-state insurance companies aren't as heavily regulated as California insurances. So there are free legal services that we could connect you with who could help get certain procedures and just gender care covered, and also like for your name and gender marker change. There's always going to be free legal services available.
Back to Blake. Along with that position, you just became the new director of the LGBTQIA Resource Center. Within this new position, how do you hope to continue to advocate and promote, advocate for trans students?
Yeah, great question. So I think, first, the center's mission is to support queer and trans students through programs, resources, outreach, and advocacy. So any way that I can support staff and our student community with those things, my door is always open. Please send me an email, come talk to me, call me. I want to hear from the community. I want to hear from trans non-binary students and staff. Not many people know that our center actually is the only one that also serves staff. And so, yes, I think also just like empowering students and continually letting them know that even though we're LGBTQIA Resource Center staff, we only have so much power, even at the university. And so when students get together and they advocate, like, you really have much more power than we do as staff. And I think that's something that students, some students tend to forget or need reminding of. Yeah, I would always empower students to advocate and work with us on any advocacy issues that we can signal boost for you. I can definitely say, going back to the question, is what I would like to do as director is really, meeting with different departments and creating an assessment for each of them to make sure that they're all trans inclusive and that they do respect, that there are policies in place that will prevent dead naming and misgendering, and that they're all trained. And there's just so many things. Meeting with the gender care team to problem solve as needed, or just really trying to empower students and staff to support students.
Yeah, and one way that students can accomplish student-led advocacy is through student government. So on campus, we have the Associated Students of UC Davis, or ASUCD, and within that, they have 6 different commissions, and one of those is the Gender and Sexuality Commission. And so, for example, this year they're working on advocating for increasing the number of gender-inclusive restrooms that we have. So if you are interested in getting connected to that, I would lead you to ASUCD.
Thank you. Is there any other last takeaways that any of our panelists would love to give about either their organization, their positions, or something that they would specifically like to mention that hasn't been mentioned yet? We can start with Raina.
No. I think coming out of definitely the work that you're doing at a campus level and building the community is really important. And I think transitioning into like a professional setting can definitely be a lot. And it definitely requires people who are willing to speak up, and particularly like allies as well. I think people who are not trans themselves but have been willing to be advocates for me have been really important. So definitely happy, and Femdems is happy as well to continue like working on this issue. I'm happy to be a resource for anybody. I know that these folks are as well. As far as like transitioning into more professional like adulthood settings. Just really, really appreciate the time and looking forward to if any folks have like questions or anything like that. But yeah, thank you.
And I just want to plug some of our programs that are coming up, specifically to support the trans community. So on November 17th in the evening, we're going to have kind of a 2-part event. It's going to be a trans advocacy network reception at the Minetti Shrem, where new and returning trans students will get to meet the Trans Advocacy Network or people on campus who support them wholeheartedly. And we're also having a meet and greet there with Angelica Ross. And then right after that, we're moving over to the Mondavi Center to have a conversation with Angelica Ross about trans liberation. So keep an eye out for that, and you'll need to register for both. So.
Yeah, super exciting. I'm glad you mentioned that. Another thing is kind of what I said earlier, like reach out to us. We want to hear from you. You know, we want to be student-centered. That means we need your voices. So if you have an idea for a program, reach out to our community coordinators, you know, our student staff, reach out to us. Yeah, we can't do this unless we know what your needs are and what you would like to see. So please just reach out.
I want to thank our panelists for taking time out of their busy schedules to come and talk with us. And I want to thank everyone for watching. And unless there's any last remark.
We can take audience questions.
Yeah, if anyone in the audience has any
If
questions.
anyone has
Maybe
some
we can
burning questions.
stop, but maybe just so like, do we have an anonymous way to take questions, or maybe you want to stop the live stream and then take questions?
Yeah, we can do that.
Yeah, we'll do that.
Yeah.
Bye.
Thank you.